Okay.
There we go. So Ben, if you want to go ahead and introduce yourself.
Sure. Well, thank you very much, and it's great to be here and talk with you all over the Zoom call. The first couple, I'll introduce myself a little bit. I'm Ben Lefever with Certintell Telehealth, and really the topic today, the core of it, is going to focus on this newer way of delivering care called remote patient monitoring, but really kind of tie that into how it can help reduce provider burnout and certainly and most importantly improve patient engagement, which I think goes hand in hand. We know all providers are in the healthcare space to help patients, and if you're able to do that utilizing new technology, all under the goal of the quadruple aim, we're finding that it does increase provider satisfaction, decrease burnout, and again, improve patient engagement. So a little bit about Certintell. I'm founder and CEO of Certintell. We've been supporting underserved populations since 2014 via telehealth, chronic care management, remote patient monitoring services, and really a mission-driven organization. So as a result, we work with quite a few rural health clinics, federally qualified health centers in rural settings, and critical access hospitals throughout Iowa and throughout the country. And so a little bit, I want to start these first 12 to 14 slides that we'll talk about. I'm really preaching to the choir when we talk about contributing factors and data behind, health provider burnout, but, really segue into the core of the program, talking about, how remote patient monitoring supports the quadruple aim, of course, provider satisfaction, and as well as patient satisfaction, and certainly how RPM, which is remote patient monitoring, truly contributes to improved efficiencies and effectiveness of patient care. So as we move to the next slide, workforce shortages. Again, this is something that you all live and breathe every day. What does it look like for healthcare systems and clinics overall? Where are we at today? Pretty sobering statistics. About 80% of healthcare workers have quit their jobs during the pandemic. And again, CMS is really trying to provide reforms in place to decrease burnout and increase satisfaction by saving the healthcare industry dollars, millions of hours and dollars. So, what can be done? Again, with the sobering fact that many healthcare workers have exited, the healthcare workforce during the pandemic. You see the statistics here, and again, this is preaching to the choir. You all that are still engaged, still driving improved outcomes. I've lived this throughout the pandemic, and and still trying to deliver what we all know is called the quadruple aim. And so what is the quadruple aim in healthcare? What does it mean for healthcare systems? We went from we used to be the triple aim to now the quadruple aim, and soon to include health equity, which is really important when we talk about underserved rural communities, particularly that have some disadvantages in getting overall access to health. So again, the overview, most of you know this. This is what the CMS payers all focus on. The quadruple aim: improve the patient experience, certainly improve the health of overall populations, and do that in a value-based care delivery model to reduce the capital cost of healthcare, and of course, improve provider satisfaction. And that's not just provider, that's staff, team, everyone that's doing the best they can to engage, particularly their high-risk patients in the healthcare ecosystem. So some of the things that we talk about improving the patient experience, particularly in rural areas, potentially a higher rate of older population, Medicare eligible. You continue to try and engage those patients, particularly that are high risk, not just annually during their annual wellness visit, or if there's unfortunately an ER visit, utilizing different tools to stay connected with the patients. Certainly, email reminders, appointment reminders, SMS text messaging, health education are all unique tools, of course, tied to what really came in the forefront with the pandemic, telehealth video, including video and phone. And so again, reducing the per capita cost of health, we all looked at different ways providers during the pandemic continue to engage patients via remote delivery of care. Providers are able to, fortunately choose phone calls over video. We know in rural broadband and connectivity is still a problem. And so it's at least good that through the pandemic, it highlighted the ability to provide quality care through telehealth and video consults. And what's interesting, there's considerable amount of data that shows that avoiding emergency department visits through telehealth can save more than $1,500 per visit. And that's the big reason why particularly in the employer space, you're seeing a lot of offerings around non-emergent type visits through kind of those direct-to-consumer telehealth models. And again, improving the overall population of health. I'm sorry, let me go back here. Improving the overall population of health. Certainly that goes to engaging, the high-cost chronic patients and patients at risk. And again, we know with the shortage of providers, folks exiting, it's very challenging to spend enough time with the patients that need more time, again, because of the shortage of providers. But it's interesting, what's happening now and how teams are starting to coordinate support for patients that are high risk. And we'll jump into that a little bit further as we talk about specifically remote patient monitoring and other chronic care management services. So again, improving the health of population, three-pronged approach, evidence-based, looking at, individual clinical expertise, patient values and expectations. And one of the things that we've also seen during patient surveys, through surveys we've done in partnering with underserved patients in rural and urban settings, typically, low-income Medicare, Medicaid, patients now expect to be delivered care in different ways to be more accessible because they've experienced that during the pandemic, but we still obviously needed to be clinical and evidence-based. And fortunately, what we've seen through organizations like HERSA and others, they're supporting a lot of evidence-based education and research around creating a network of providers all there to help coordinate care in a remote way. And so there's been a lot of activity and engagement and financial support to continue to try different ways of delivering care, particularly to the most vulnerable among us. So again, improving the provider satisfaction. We know physician burnout is real, and providers, are stressed around manageable work hours. But one of the things that we'll kind of segue into is, how can different unique tools help with that physician burnout, for example, to be able to know that patients are doing well or trending the wrong way in between in-office visits is one way, because we know providers getting this to do well for patients. So again, improving provider satisfaction continued, having data prior to seeing the patient is a real exciting trend we're seeing, particularly around chronic care management and a mode of that, which is remote patient monitoring. And certainly you will continue to use tools and technology where maybe it's not necessary for the patient to come into an in-office brick and mortar clinic, but be able to schedule more convenient ways of engaging patients through technology, particularly telehealth. And the pandemic really out of necessity showed that. I know most of the trends are kind of back to business as usual, but again, patients now expect this delivery care, but how can this also be viewed as a tool for provider satisfaction and be able to see patients in office that really need to be seen versus can be done, for example, in a virtual environment. So let's talk a little bit transition for supportive services. We're talking about services like CCM. So CCM, for those that don't know, is chronic care management services. My guess is that most, whether you're a federally qualified health center, rural health clinic, critical access hospital, you looked at or started perhaps a chronic care management services CCM program to engage your high risk patients. We'll talk about more of the requirements there. RPM is a little bit newer, but it's a very similar program to chronic care management, and we'll dive into RPM in detail here in a moment. So just, CCM, which will segue into remote patient monitoring. It's a Medicare program managing patients with multiple chronic conditions. So this has been out since 2015, particularly for, rural health clinics or federally qualified health centers that are contracted differently. You're able to bill a unique G code to really get paid for that non-face-to-face care coordination that rural health clinics and primary care providers in particular have always done. And so, keep that CCM program in mind as we touch a little bit around remote patient monitoring. And again, a program to really engage your high-risk patients by placing and connecting with a connected device. So, CMS continues to promote technology and data sharing, where again, some of the examples that I'll to touch on, for example, in partnership with the American Heart Association, CMS and HERSA funded federally qualified health centers that had a percentage of patients that had hypertension and uncontrolled hypertension, utilizing a connected device that was real time. And again, utilizing tools like telehealth and other tools are really pushing forward and promoted by CMS and HERSA. We've seen over the last couple years. So, what is remote patient monitoring? We talked about CCM. Go back here quickly just to view that program. It's 20 minutes of engagement, non-face-to-face care coordination with patients with 2 or more chronic conditions. The engagement can be done by clinical staff, auxiliary staff, with the oversight of the billing providers, the physicians, nurse practitioners, and PAs. Remote patient monitoring is very similar. It's a calendar month program to really drive patient adherence and behavior change. And it's a new way of tracking the patient's trends, vitals, biophysiological parameters over time, and being able to act on that when patients are out of range. And again, we certainly understand that tied to patient engagement and patient satisfaction. But what we've seen as well is that providers that have the support to enroll patients that are candidates for this also have a lot of satisfaction, because they're able to keep patients out of the ER and keep them well in between those in-person visits. So what are some of the steps around remote patient monitoring that a clinic would want to look at? Is, what do you do once? What's recurring? Step one, of course, is enrolling patients in the program. Let's say they're maybe you're going to focus on hypertensive patients or your diabetics, for example, or heart failure. You identify, which patients you're going to enroll in the program, and then there's a coinciding device, and we can touch on that in a little bit. Determine device logistics. Are the patients going to come into the clinic? Or we got, are the devices going to be shipped directly to the patient? And then what, tools and support you have in place with technical issues and things like that. But really where the crux of the program is, and the benefit is in the bottom left, really regular tracking and ongoing care of these patients. That's really where the value is when you talk about population health, lowering the cost of care, being able to catch patients that are trending the wrong way, around their blood pressure, to find out what's happening before they have to have a hospital event. And then obviously one of the key challenges too is the team in place to to escalate when things are out of range, alerts come in, who's reaching out to the patient, and then the ability for patients that need a little more support to schedule routine check-ins, i.e. via a telephonic follow-up call or a video conferencing call. So, enrolling patients in the program, this is where some folks, look at, okay, how are we going to do this? What is the dedicated team to engage in this program? How do we consent and enroll through our proper procedures? What's our policy around doing that? Certainly, we're starting to see a trend of payer stepping up and reimbursing for remote patient monitoring. Similarly, when they started the chronic care management codes, Medicare Part B, Medicare Advantage, and even state Medicaid under fee-for-service, we're seeing positive trends in providers being able to get paid for this type of engagement. And so you need everything in place around your billing, everything set up to make this a sustainable program that's not just reliant on grant funds. And so when you look at the device logistics, again, we talked about grant funds and so forth. HEP C, we've seen is invested in this, particularly a significant amount of funds particularly around hypertension. Are we going to look at devices that connect via Bluetooth or out of the box, ready to connect via cellular? And what are the costs associated with those different tools, but also what's easiest for the patient to engage in the program? Do they have to download an app? Those types of things. What training is involved to make sure the patients are comfortable with the tools? So when you look at, again, sending out any type of technology, customer support, patient technical support is important. What's the team in place to do that? But what we've seen in partnership and working with rural health clinics, critical access hospitals, federally qualified health centers, really exciting to see that patients are more and more tax savvy. But again, you want to keep it as simple as possible for patients engaged in a program. Unfortunately, a lot of learning has happened over the last couple of years, which devices are most effective, particularly for older patients or lower income patients as well. And then again, this is really where the benefit of the program is a staff really engaging with patients, reminding them to take their readings. A lot of this can be automated through the technology and solutions in place. And again, measure the regular monitoring and tracking, because that's the real benefit of RPM. It's not necessarily an alert system to reach out to every single alert, but to be able to engage and monitor patients enrolled. How are they trending over time that have a connected device and engaging in remote patient monitoring? And again, looking at what teams in place, similar to a CCM program for folks that are reaching out to patients, 20 minutes a month, that having that type of team in place, particularly when patients are in a critical or caution range that needs to be engaged in real time. What's the team that's going to do that? Or can we find partners that can drive that alert and escalation to support and scale this type of program? So again, one of the things that we've seen with remote patient monitoring is that, going back to provider satisfaction, is that when patients feel they're supported, they're trending the right way, when you have those follow-up encounters, those are a lot more impactful visits. And again, the providers are able to see, how the patient is trending around their blood pressure, A1Cs, weight, all of that, and really have that encounter, that face-to-face visit, very meaningful for patients enrolling in this. And we've starting to drive patient satisfaction surveys, and patients enrolled have high satisfaction in engaging in a program like this. They really feel supported and benefited around that. And again, that goes back to that, that quadruple aim, the patient satisfaction of feeling like their care team really cares about them and is available and monitoring them when they're not in between those in-person visits. So, what are the types of devices for remote patient monitoring? I'll say the devices have come a long way. What do I mean by that? Early on, a couple of years ago, most of the devices were Bluetooth enabled. A lot of pairing issues. The patient had to download an app, register with an app via an email. And we know many patients, whether they're older or lower income, don't have an email address. And so it just became very, very challenging. The app didn't allow, or the application didn't allow a provider or care team member to view their entire patient population as a whole. Fortunately, the types of tools are out there have made it very easy for patients. For example, there are choices. You can have a cellular enabled device that has a cellular chip built into the glucometer, the scale, the blood pressure, even the pulse ox. And so once the patient gets the device, It's out of the box, ready to connect without having to download or register any of that. So folks that are looking at this type of program from a value-based perspective, provider satisfaction, patient engagement, just know that the devices themselves have come a long way over the last couple of years. So, this is an outcomes-driven approach. And again, going back to, providers that are battling and engaging their high-risk patients all the time, it really improves the knowledge of the patient's health, improve patient compliance of treatment plans, satisfaction, increase provider visits. Patients are showing up for the in-person visit because they want to know how they're trending around their blood pressure, their hypertensive numbers, systolic and diastolic. Certainly from an overall, again, population health and cost, there is data to show that our remote patient monitoring programs do reduce readmissions, and it really creates a strong care team of communication, because similar to CCM, who's doing most of the engagement with patients in a remote patient monitoring are the clinical staff that are overseen by their providers, nurse practitioners, physicians, PAs. And so they're able to kind of talk about, hey, we have, this cohort is really trending well, doing great. We're continuing to be a cheerleader for them to continue to take their readings and follow up and engage with us. And so it does really increase care team effectiveness and communication, which I think overall, again, we found anecdotally does improve just the overall team morale and collaboration. So, again, Certintell, we work with health systems and partner to improve these outcomes through, a unique virtual medical practice. We know that, that staffing is a challenge. And so our goal is really to partner alongside organizations to help drive this program uniquely. And so we've got a lot of experience because we're focused on underserved communities of really helping support driving this program for patients and organizations that want to embark on this new way of delivering healthcare via telehealth. And again, I use those terms independently: telehealth and remote patient monitoring. Remote patient monitoring is really a mode of telehealth. Most of you are very familiar now with the telemedicine, telehealth, the video or audio component, store and forward. Think of teleradiology, teledermatology. Remote patient monitoring is another mode that's really gaining significant traction. Certainly, it has around the pandemic and post that as well. So, if anyone has questions, particularly on data research information on remote patient monitoring, absolutely reach out. Our care management specialist, Chris Allen, get RPM at Certintell.com. The number is there as well. Love to talk to you about what we're doing, particularly around some exciting initiatives around HERSA. So there's a HERSA evidence-based telehealth network project that's in year 2 of 5. That working with a couple critical access hospitals. We're about to onboard a couple rural federal qualified health centers as well to really support this type of program, that is grant funded as well. So certainly reach out. There's some more resources here talking about, where some of the information came from, references there. But, continue to do what you're doing. Look at new ways to, of course, improve patient satisfaction, which you do all the time, but also understand that some of these new ways of engaging patients, like remote patient monitoring, we're finding really creates a sense of provider satisfaction as well to provide a unique way of engaging patients in between those office visits. So I went through it pretty fast. I don't know if we have any questions or anyone on the call here, but certainly, again, any questions at all, please reach out to us. Iowa folk, we're Iowa, headquartered here in Iowa. And really, so like I said, this is not a sales pitch, but we're looking to continue to collaborate with other rural health clinics together to really impact, Iowans in our most vulnerable communities.
Thank you so much, Ben. A lot of great information that you shared. I'll give maybe a few minutes if anyone has any questions.
I don't have any questions. I really appreciate your time today.
Yeah, no, great to be on the call, and thank you for the opportunity.
Sure.
Sure. Where are you out of, Jalissa?
Jalissa, I'm out of Marengo. I am the Family Medical Clinics Manager for Compass Memorial Healthcare
Wonderful.
here.
Great. Wait, Marin, so where is that? I should know. Where is that? Is that?
It's just about 30 miles west of Iowa City, Cedar Rapids, like the corridor area.
Ah, got it.
So on the interstate, on Interstate 80, there's Kinsey.
Yep.
It's that exit.
Got it. That helps a lot.
The big turning tractor.
Thank you. Thank you. Well, yeah, if you have any questions or things like that, particularly around, I should have put a little more information on this HERSA evidence-based initiative that's rural Iowa focused, but a lot of opportunities to add additional sites as long as in a rural area. And again, it's a no-cost program because it's grant funded and support for folks that maybe want to explore a little bit of remote patient monitoring. There's a medication review support as well. And so, so Deb and team, if anybody's potentially interested in that's rural, happy to have that discussion. It is a HERSA funded project that's on year 2 of year 5, but we can continue to add more sites.
Okay, great.
Wonderful.
And they can contact Chris if they have questions about that. Okay.
You got it. Just contact Chris and we'll follow up if they just want a little bit more information on what that initiative is. We have a couple critical access hospitals and, like I said, rural health clinics and federal qualified health center. Looks like hopefully it'll come on board here, and happy to talk to others that may be interested. All right.
Okay.
Thank you so
Great.
much.
Thank you.
All right. Take care.